to everyone, this is going to be recorded, so it can be posted later. So all your pretty faces will be included. And a reminder, any questions that you have, feel free to put it in the chat box. We'll answer the questions at the end. So anything that pops into your little minds, let us know what you are looking for. And I think that's all I had to remind before I jump into presenting our guest speaker. So our lovely guest speaker today is Tracy Gallant, that lovely face in the window there. I've had the pleasure, Alexa and I have had the pleasure to work with her at our clinical site. So we're really excited to have her as a guest speaker. So I'll let you know a little bit about her. So Tracy has worked for the last 15 years as a respiratory therapist at Royal Inland Hospital. And so in that time, she worked as an acute care respiratory therapist. She has worked in the community. She's a clinical resource educator. So she's filled a lot of roles and she has quite a bit of knowledge. And with this experience, she has been able to become a co-coordinator of the pulmonary rehab program or rehabilitation program in Kamloops over the last 3 years. So she's had to navigate this lovely pandemic and figure out how to do an in-person class online. So I think she'll be pretty good today, if I say so myself. So her real focus is really giving clients education about their respiratory health so they can manage their own lung conditions. That's what we're trying to do, is empower you. So when she's not doing all of these fabulous things, this girl likes to spend time with her family. She likes to travel, she likes to hike and bike, and then eating s'mores while she's camping. Who would have thought that? So without further ado, I'm going to hand this over to Tracy, and thank you so much.
Awesome. Thank you for that wonderful introduction. Bear with me as I just pull up my PowerPoint presentation to share with you. All right. Hopefully you guys can all see that. Wonderful. Perfect. All right. So welcome everyone. So today I'm going to be talking to you about COPD action plans, which is a key component in COPD management. For today's talk, we're going to cover what is a COPD exacerbation. We will define the classifications of an exacerbation, what triggers them, and how to prevent them. And also, what is a COPD action plan? And lastly, we're going to look at an example of a plan and review some case studies together. So what is a COPD exacerbation? So an exacerbation of COPD is a worsening or flare-up of your COPD symptoms beyond normal day-to-day variations in breathing. So throughout this presentation, I'm going to use exacerbation and flare-up interchangeably, just so you're aware. So it's not always easy to tell the difference between a bad day versus the start of a flare-up, but a flare-up usually continues to get worse over the day and does not clear up with rest and extra puffs of a rescue inhaler, such as salbutamol. A COPD flare-up may come on gradually or it may suddenly. The three key symptoms of a flare-up are increased shortness of breath. So you may notice that you become more breathless than usual with routine activities, like maybe walking to the car or having a shower. Increased cough. So your typical cough may increase in severity or frequency, or even a new cough may develop. And an increase or change in mucus. So you may notice a change in the color of your mucus, maybe from clear to yellow, green, or rust color. And perhaps the amount of mucus that you're bringing up may have increased as well. So it's important to know flare-up symptoms, as they may continue to get worse without extra treatment. This can be very serious, and it may cause you to go to the emergency room or even get admitted to the hospital. So the previous slide listed the three key symptoms to watch for, but I think it's worth mentioning these additional symptoms to be aware of. Maybe you need the use of a rescue inhaler more often. Maybe you notice some wheezing or unusual fatigue, fever, new or worsening swelling in your legs or ankles, and chest tightness. COPD exacerbations are classified into mild, moderate, and severe based on the level of therapy required. So mild flare-ups are treated with short-acting bronchodilators or rescue inhalers such as salbutamol and can be treated at home. Moderate flare-ups are treated with short-acting bronchodilators plus antibiotics and or oral corticosteroids such as prednisone. And these are usually treated at home as well. A severe flare-up, however, requires a visit to the emergency room or hospitalization. Moderate and severe exacerbations can actually lead to permanent lung damage, impairing lung function that may not ever fully recover. It may be possible to limit the severity of an exacerbation if you get help early by starting your action plan or calling your healthcare provider before a visit to the hospital is necessary. Regardless of classification, we must be vigilant to do our best to prevent COPD exacerbations. Even one single COPD exacerbation could increase the risk of future flare-ups. So what triggers a flare-up? Maybe after you get a cold or flu, when you're tired and run down. Maybe you were exposed to smoke or air pollution, changes in weather, mood changes such as feeling stressed or anxious, strong fumes from perfume or other scented products, maybe even allergen exposure to pollens, molds, animal dander, dust, using an empty inhaler, or even using an incorrect inhaler technique can create a flare-up. So how to prevent a flare-up? Making sure that you're taking your regular daily medications as prescribed, quit smoking, exercise, staying active, eating well and sleeping well, avoid sick people and making sure that you're washing your hands well and often, avoid aggravating factors. It's important to recognize what triggers your breathing, and it makes it more difficult. And if possible, eliminate, or at the very least, limit your exposure to those things. Getting your flu vaccine annually and getting the pneumonia vaccine. So what is a COPD action plan? So an action plan is a set of instructions or steps you should take at the first site of a flare-up. It's very important to note that every person is different and needs a plan that meets his or her needs. Your action plan should be created along with your healthcare provider, kept in a prominent place in your home, and reviewed regularly. So if you use your action plan properly, you will become more independent and feel more in control when your symptoms get worse. Your plan of action may make the difference between treatment at home and a trip to the hospital. So on the screen, there are two action plan examples. Don't worry about the details at this point. We're going to go through step by step. For today's talk, we're going to be reviewing the plan on the left side of your screen, which is the BC Ministry Flare-Up Plan. It's divided into 3 color-coded sections, much like a traffic light. Green means stable or good. Continue with your regular activities and take your regular medications. Yellow means it's time to slow down and pay attention. A flare-up may be coming. Red means stop, call 911 immediately to take you to the emergency room. So let's start by taking a closer look at the green zone. So if we look at the top of this section, there are some blank spots to insert who the plan is for, the date that you and your healthcare provider reviewed your plan. Remember, it's important to review and update your plan often especially if there have been any changes in your health. There's also an area to fill in your healthcare provider's name and phone number. So this information is easily accessible when needed, especially if a family member or friend needs to call on your behalf. To remain well, use your plan of action to monitor your everyday symptoms, to take your regular medication as prescribed, and to maintain healthy life habits. When we look at the green zone, it lists symptoms to watch when my COPD is well controlled. So in other words, this is your baseline symptoms. This will be your normal. So my breathing problems have not changed. My shortness of breath, cough, and sputum or mucus is normal for me. My appetite is normal. I am able to exercise and do my daily activities as normal, and I have no trouble sleeping. So what should I do? Continue to take my medications as prescribed. This section allows you to list your current respiratory medications that you're taking, including the dose and how often you take these medications. Also, if we look on the right of the screen, we can see a yellow box that lists those possible triggers for a COPD flare-up. So any change to your normal symptoms may indicate that you're moving into the yellow zone. It's important for you to be able to recognize what your normal COPD symptoms are. So what's your baseline? If you are able to take the time to recognize what your normal symptoms are, it will make it easier for you to differentiate what is normal and what is a change. Remember, when we move from the green zone to the yellow zone, we need to take action. So in the yellow zone, my symptoms are worse. Remember the 3 key symptoms that define a flare-up? I am more short of breath than usual. I am coughing or wheezing more than usual. I have more mucus than usual. I have green, yellow, or rust-colored mucus. So if you have one or more of these symptoms, it may be the start of a COPD flare-up. So what should you do? So in this portion of the COPD action plan, you and your healthcare provider will work very closely to determine what additional treatment you will start. So some examples are, your doctor may want you to increase the dose and how often you use your bronchodilator or rescue inhaler. They may want you to limit your activities and use your pursed-lip breathing. They may want you to call and report these changes to them, or they may want you to start your antibiotic and or prednisone. So how do you know when to start your prednisone? So I start my prednisone if, after increasing my bronchodilator or rescue inhaler, my shortness of breath does not improve and my symptoms have become worse. How do you know when to start taking an antibiotic? I start my antibiotic if my mucus becomes green, yellow, or rust colored, and my symptoms have become worse. So when in the yellow zone, take action and don't wait. Remember, the longer you wait to treat a flare-up, the longer it may take to recover. So what is the take home from this slide? Don't wait longer than 48 hours from the start of the flare-up to take your antibiotics and or prednisone. And remember, if your symptoms don't improve within 48 hours of taking the above additional treatment, you need to contact your healthcare provider for additional support. If at any time when following your action plan, you end up in the red zone, maybe you have extreme shortness of breath or chest pain, or maybe someone notices that you have extreme drowsiness or confusion or agitation, this is when you call 911 for an ambulance to take you to the emergency room. Okay, so now we are going to go over some case studies together. So this will give us an opportunity to apply the information that we just reviewed together. Let's meet Charlie and take a look at his journey. So Charlie was diagnosed with COPD 5 years ago. He wears oxygen 24/7 and has been managing his COPD with the respiratory medication, with the same respiratory medications for the last 3 years. Things have been fairly steady for Charlie over the last 3 years. However, over the last 4 to 5 days, Charlie has been experiencing increased shortness of breath, increased coughing when he's walking from the living room to the bathroom, and he even started to sleep in the recliner in the living room to rest better, as he felt like he was getting more air when he was sleeping upright. He can usually walk from the living room to the bathroom without having too much difficulty in breathing. He has been using his rescue inhaler multiple times a day for the last 3 days, and he is beginning to feel like he needed his rescue inhaler even when it wasn't time yet to take another puff. Also, he noticed that his oxygen levels had dropped, and he had to increase his oxygen flow to the maximum flow prescribed just to maintain his oxygen levels. Last night, he was unable to sleep due to increased cough and severe shortness of breath. So he called 911 and he was admitted to the hospital with a severe COPD flare-up. So in this case study, Charlie was in the yellow zone, but without additional treatment, he ended up in the red zone. So what are the take-home points? Perhaps if Charlie had noticed he had a change in his baseline symptoms and he received help early by starting his action plan or calling his healthcare provider, he may have been able to limit the severity of his flare-up and prevent a hospital admission. Remember, it's important to start your antibiotics and/or prednisone 48 hours from the start of a flare-up. Every single exacerbation could increase your risk of future flare-ups, and studies show it can take up to 8 weeks for you to return to your baseline. Now I want you to meet someone else. I want you to meet Mary. So Mary has been managing well with her COPD for the last year. However, 2 days ago, Mary noticed that she needed more puffs of her rescue inhaler throughout the day. And yesterday, when she got up, she noticed that she was coughing more and was producing a different color mucus than was normal for her. It is usually clear and it had changed to a thick yellow. Today, she has a low-grade fever. So my question to the group is, do you think that these symptoms mean Mary is experiencing a flare-up? What do you think?
And if you have an answer, please feel free to unmute and tell Tracy what you think.
Or Lindsay, if you can just say, are people nodding? Because I can't see people.
Susan's staring at the screen. I'm getting a yes. I'm getting some head nods. Yes, she is.
Awesome. Yes, she is. That's right. She is having an exacerbation and looking at those symptoms and that history. So remember that definition of an exacerbation. It's a worsening or flare-up of your COPD symptoms beyond normal day-to-day variations in breathing. Mary's symptoms are worsening. They're not her normal. She is now in the yellow zone and needs to take action. So do you think she should start her prednisone at this point? So yeah, she has already increased her bronchodilator or rescue inhaler, and her shortness of breath has not improved, and her symptoms are worsening. Do you think she should start her antibiotics?
Yeah.
Remember, we look at mucus color, volume, and consistency. Her mucus has increased and it has changed from clear to yellow. So you would be right. Mary should start taking her antibiotics. So if she starts her action plan and calls her healthcare provider, hopefully she can manage her flare-up at home and prevent a hospitalization. Lastly, let's meet Ken. So Ken continues to work Monday through Friday. 2 years ago, Ken was hospitalized for his COPD. And after he was discharged, he was able to quit smoking. Since then, he has completed pulmonary rehab and stays active by walking daily. Over the last few days, Ken has noticed unusual fatigue and more chest tightness than normal. He doesn't usually require his rescue inhaler at all, but yesterday and today he had to take it twice. Is Ken experiencing an exacerbation? So yes, some people may overlook this, but Ken is experiencing a mild exacerbation because he has a change in his baseline of symptoms. He is now in the yellow zone of his action plan and needs to take action before his COPD flare-up progresses from mild to a moderate or even severe exacerbation. So if we look at all of our examples on this screen, Charlie, Mary, and Ken, all three are experiencing a flare-up. They are just at different stages of exacerbation. So while Charlie was having a severe flare-up and had to go to the ER, maybe Mary won't have to go to the ER and can manage her moderate flare-up at home if she starts her action plan and contacts her healthcare provider. Ken may be able to stay at home, referring to his action plan and treating his mild flare-up with bronchodilators or rescue inhalers, and by resting and using his pursed-lip breathing to manage his symptoms. It's so important to know your baseline symptoms, so when your symptoms change or worsen, you can refer to your action plan that you have been given by your healthcare provider. So remember, learn about your COPD from valuable resources. Learn about the disease process that you've been diagnosed with. That'll empower you and give you that self-management key that's so important. Take your regular daily medications as prescribed. Don't wait more than 48 hours after the start of a flare-up to take your antibiotics and/or prednisone. When you start an antibiotic, make sure that you finish the entire treatment. Be as active as possible. Inactivity leads to weakness, which can cause more flare-ups or flare-ups that are worse than usual. Making sure that you follow up with your healthcare provider within 2 days after using any of your prescriptions for a COPD flare-up. Check your expiry date on your flare-up meds, especially if you have filled them at home and filled your prescription. So in summary, prevention, early detection, and prompt treatment of exacerbations are vital to reduce the burden of COPD. Let me stop sharing so I can actually see everyone again. There you are. So I don't know if you guys were able to share in the chat the link to that COPD plan that we went through today, in case anybody wants to have a copy of that to take in to see their doctor.
Alexa will post that in the chat box. So there is a copy of a COPD action plan. There it is. She sent it away. So if you want to take a look at that, it is available. I want to open the floor to anybody with questions before I start firing off some questions that I thought of. They're easy, Trace, I promise.
I have a question.
And who's speaking?
Maureen,
Maureen, go for it.
my respirologist, my doctor, had an action plan for me, and I would take, at the start of a flare-up, I would take antibiotics and prednisone together. She never did give me an option of just prednisone or just antibiotics. Do you know why that would be?
No, I mean, it depends on how long ago you did that action plan. Have you reviewed it since then, right? Things may have changed over the years as far as the progression of that. You know, as we know, antibiotics, you can become, what's the word I'm looking for?
Resistant.
thank you, resistant to antibiotics.
Right.
And so we're more conscientious of that nowadays as well.
Right.
That we only want to take them as needed, you know. That would probably be my first thought process, is maybe that's something that maybe you need to review again and go over it again with your doctor.
Well, it's prednisone. I guess I know what antibiotics do. I've never understood. I don't know what prednisone does. I mean, I just took them because she told me to, but does it act like an antibiotic, or does it act like a, what does it do, prednisone?
Yeah, no, that's a really good question. So, you know, with prednisone actually is an anti-inflammatory. And so when we're having exacerbations, inside of our airways become inflamed and really thick and swollen. And so prednisone actually helps to bring that swelling down.
Oh,
Yeah.
okay. Yeah, I should ask her that, because I just, so I guess normally you would start with prednisone, and if that didn't help, then you would add the antibiotic.
Yeah, I mean,
the way that,
for sure, the key with the antibiotics is looking at that mucus. So those three things, right? We want to look at the color, the consistency, and the volume. And so if those things are changing, that's when we're thinking we have an infection, a bacterial infection, and we'll need an antibiotic to fix that.
or the temperature. I would think if you had a temperature, that
the fever. Yeah, and that would, I mean, that would be connecting with your doctor at that point as well, right? When things are progressing, you're going to be calling your family doctor or your healthcare provider to get a further assistance at that point. Yeah.
Right. Okay, thank you.
We had Jacqueline with her hand up.
Hi, great job, Tracy. That was so informative. I just had heard some information about having the same antibiotics and just some concerns as well around resistance. Do you have any information on that?
Yeah, actually on the bottom, on one of the pages of, I believe on that action plan I'm sending out to you guys, you're not supposed to use the same antibiotics back to back when you're having flare-ups. And so it's important to actually, I always think of a COPD diary, right? Keeping track of things. When are you having a flare-up? What medications did you end up taking? What was the antibiotic that you got put on? And then you have that information if you're to have back-to-back flare-ups or that, and you can create, let the doctor know that you need a new antibiotic. So yes, that's right. So on the action plan that I'm sending to the group, there's a spot to put that information in, so you can keep track of it. Yeah, good question, Jacqueline.
Great. Alexa, did you have a thought?
Well, I was just going to add on to that. Another good point is if you're unsure what antibiotic you took last, that's something you can always ask your pharmacist too, and they're able to look. Or if you're unsure, like if your doctor made a prescription for a certain antibiotic, you can always just ask the pharmacy, like, hey, did I take this last time? And they can look into changing that for you too.
I think that's great. And that's good. I think that's wonderful. Thank you for that question, Jacqueline. Any other questions? I have a couple. I have like 4 or 5. And they're really simple. But we know in BC that there's a shortage of physicians. So if you have a patient, Tracy, who needs an action plan to be developed, who can they go to? Anybody? Like a respiratory therapist can help them build it, or?
But it's, I don't know, Jacqueline, if you have anything to add to that, but you need a healthcare provider.
So you need a healthcare provider.
Yeah, you need somebody that's following you
Okay.
closely. Yeah.
And
so if you don't have a healthcare provider, but you've been diagnosed with a lung condition, make sure that you're connecting with 811 and getting put on the list with a chronic condition, so that hopefully you can get a provider sooner, right?
Okay.
Yeah.
They're talking about your in the pharmacist being able to write prescriptions and that, and I would think, like, I'm sure my pharmacist knows everything about my condition because I've been going there for years.
They may know about the medications, but they may not understand the pulmonary side of your condition.
Right.
But I would hope that as a pulmonary patient, you would be connected with a physician that specializes in that field, and then they can be the one to assist to develop it.
Kind of put on that point is a lot of these pharmacists will have online virtual doctors. And I know in our community that we see a lot of patients that aren't attached to doctors, but they have recurrent COPD exacerbations. they will go to their online virtual doctor and they stay within, for instance, example here in Kamloops Marchetti or Manchetti's pharmacy, they have a virtual option. And so they kind of just keep going to that same pharmacist to keep that same online, what's what I'm trying to say, like their portfolio of their health on that area. So you can see a virtual doctor if that's something that's a barrier to getting an action plan.
That's good.
That's great. I'm sorry, I might have missed it in the talk. How often should you be updating your action plan, Tracee?
Good one. Good question. Yeah, because I often don't think that they are updated as often as they should be. I don't know the specific recommendation. I have read in certain articles every 6 months, but at least every year, at least annually, you should be reviewing, making a specific doctor's appointment to review your COPD action plan and saying that when you're booking your appointment, so that hopefully the doctor will have a bit more time with you to go through everything with you and answer any questions you may have. Yeah.
That, and I think if you have any big changes in your medications too, like if your puffers change, then that'd be like a very good, just so that, during those times, if you're going into the yellow or red zone, you don't want to be thinking, oh, well, here it says Symbicort, but I'm not on Symbicort anymore. So if you have any medication changes.
Yeah,
I wonder if I could make a comment and just go back to our information around follow-up. So that online physician, it works great. Some communities have urgent primary care clinics as well that you can connect through and get some information. There are community respiratory therapists that can do assessment and create plans for you, and they would connect back with your virtual doctor or the primary care clinic. Some community respiratory therapists, you don't need a referral from a primary care provider for, so you can do a self-referral, and some you need one. So you would just have to figure out what you have in your area.
That's great.
Okay, I have a question. Hello,
Hi, go ahead.
Big Al here.
Hi, Big Al.
I don't have any medicine I take. And I've never had a flare up, so this has been very, very interesting. I think the only thing, I walk 100 yards and I'm out of breath. So what I'm on 2 puffers. One is an Ultra Bro Breezehaler that I take every morning at the same time, just one a day. And the other one is a Tiva Salbutamol or whatever it is. I take that. So those are the only 2 things I take. But I don't take any medicine. Am I lucky?
Well, the puffers are medicine.
Yeah.
Those puffers are medication for your lungs specifically.
Oh,
But Al, you're saying you don't take any oral medication.
no.
You don't take any pills. No.
Oh, I take all kinds of oral stuff for different things. Sure, diabetes, all this stuff. Oh, yeah. I take 11 of them. The pharmacy loves to see me coming every day.
Cha-ching. But you haven't
Can I
had
ask
to take medication for your oral medication for your lungs at this point.
No, but I'll
Okay.
tell you what I do sometimes. If I feel like it at night watching TV,
Mhm.
I have an oxygen concentrator.
Okay.
And I'll throw that on for maybe 10 or 15 minutes. And I don't really know the reason why I do it, but I just do it because it's sitting there.
Yeah, you got to use it. Does it make you feel better?
I don't know. It's sitting there and I say I've got to use it. So, I mean, it's, I would say, yes, I guess it does. Yeah.
And
Is your
who-
prescription to use it daily or for exertion?
What the,
the
Oxygen.
oxygen, when you got it, who told you you needed it?
I
Was
think
it
the doctor did suggest that I have it.
Okay.
But I mean, there was a year there I never even used it. It was just sitting there. I don't need it.
Okay.
Well, maybe he needs it and he'd be able to walk further than 100 yards.
Do you have someone that comes and assesses you and comes and checks in on you every year for your oxygen? Like, do you pay for it or does the government fund it?
I bought it.
You bought it
No,
yourself.
But the government, my plan contributed to it, yes.
I would suggest, and I'm assuming that Tracy and Alexa and Jacqueline will have the same one, is I would refer back to your healthcare professional or whoever your practitioner is and say, I have this concentrator, I purchased it myself. Nobody's ever followed up with me to see if I need it, what prescription I might need or when I need it. So then you're using it the way that it should be used.
Good point.
I
Because the
would
thing
say
to remember is oxygen is also considered a drug too. So we want to make sure that we're using it correctly.
and safely, oxygen, don't smoke near oxygen. Shake, shake, shake.
It's good
And
to
it's
know because
also-
then someone can follow you up to see if you're on the right, if you need to be taking it for one, and if do you need it for exertion, or what the big thing is, they'll check to see what your blood oxygen levels are to make sure if you do require it, how much like what the setting
I
you
do
need on.
check my blood oxygen level every day. I've got one of those little things that.
It's a different kind of check that goes in and checks your blood by doing a poke, and they'll let us get a good idea if you need the oxygen or not. And then if you do, then you would qualify through the government, and that would be funded. So then you'd have someone that checks on you yearly to make sure that that's.
Yesterday, I got on a program similar to this, and it's every Tuesday and Thursday for 1 hour, an exercise program. And I did it yesterday. That is excellent. That is very, very
Awesome.
good.
Were
That's
you
what
with
Tracy
Tracy
is.
now?
Hmm?
Were you with Tracy?
No.
Yeah.
Oh,
Jill?
No.
that's what Tracy does.
Well, it was
That's exactly
yesterday.
what she does.
What
Was it
city do you
Jill?
live in?
Hmm?
What city do you live in?
I'm in Langley, BC.
Okay,
Awesome.
so you're in the
Yeah.
lower mainland. Okay,
Yeah.
so
Okay.
you won't get Tracy, but you'll get somebody almost as good as.
Oh, it was excellent. It was, I was tired. I was out of breath. It was very well done. Yeah.
Good. Lovely.
Was it Jill? Was it Jill?
Yes, that
Yes.
was it.
Oh, it's-
Yeah.
She has over 100 people in her class, and everybody from
Wow.
across Canada goes, it's online.
Yeah.
Al?
Yes.
Jill would be a really good resource to talk to about your oxygen. She'll be able to look into it a bit more for you to see like, hey, should we keep you on this, or who to connect with? Because she'll have connections with your family doctor or whoever you see
Okay,
to see if it's appropriate to stay on it or not.
good.
But just to answer your question, Al, you don't have a COPD action plan, and it's never too early to get one set up. So you just need to make a doctor's appointment to connect with your physician and get that set up. And it sounds like you've got your rescue medication, your bronchodilator at home. So that's great. That's great. But just in the event that you do ever have a flare up, to have that action and plan in place would be so beneficial, right? You have
Thank
access.
you very much.
Mhm.
Thank you.
Thanks, all. All right, I have another question. Tracy, what would you recommend? I have an action plan and I have it on a piece of paper. Where should I keep this paper?
I was going to bring that up.
Keep it in different spots.
I love it on the fridge, because especially when it's brand new and you're just learning your action plan, having access to it to review it frequently is so beneficial, because if you just read it once and put it away, you're not going to remember what the steps are, right? So it's definitely takes time to review, to feel more confident, to gain that, right? Confidence in your ability to actually understand when to implement your action plan. So I like the fridge.
Yeah. I like the fridge too. I go to it all the time.
Yeah.
I'll be looking at it all the time.
Yeah.
Another spot a couple people have also brought up in the past is they'll keep it wherever they keep their rescue inhaler. So that they know they're going for that, then sometimes they say like, I don't have a spot, or my fridge doesn't have magnet to put it on, or something like that. So rescue inhaler. But make sure it is somewhere accessible. So that's the last place you want to be trying to search for your action plan when you're having troubles breathing.
Yeah, and you're right, Alexa, especially if you are struggling so much that you can't breathe, and somebody has to call on your behalf. If it's on the fridge, other people would have access to that too, not just yourself.
Mhm.
Yeah.
Now, I have another question.
Ooh.
I don't have COPD, but I have asthma. Can I also have an action plan?
Yes, we're not reviewing that today, but absolutely, yeah, absolutely, yeah. An asthma action plan is very, very important for asthmatics. Yeah.
So it's the same concept where you've got your green, that's your go zone. You drive as fast as you want safely. And then once you start seeing that yellow, you need to slow down because something's changing. And that's a change that you need to treat. And maybe I'll let Tracy explain as to why, or maybe she doesn't need to, but it's important that we don't let you get into the red zone, because then that infection is so far gone, it takes longer to get you back, right? And Tracy mentioned a few times that the worse the infection is, the longer healing takes. But whenever we have infection and we get healing, inevitably we get scarring. And that makes your breathing and your airways a little worse off every single time. And it makes you more susceptible, like Tracee said, to infection. Any questions on that?
Kind of to add on that too. So last week we learned about pulmonary function tests, and we learned about the FEV1 number. And Dr. Campbell, if you haven't had a chance, he talked about that's the number that tells you the severity of your lung disease. And when we have flare-ups, that number can decrease, and it can take some time to get back up, and sometimes may not even get back to that number again. So it's why super important to keep on track with our medications and try to prevent these flare-ups from going into that red zone to cause that number to go down.
I think that's great. Al, are you sharing your screen?
Oops.
What about keeping it in your green sleeve on the fridge?
Great. I think we're good now, right?
I
Yeah.
think.
Any other questions? All
No
right,
questions.
so there's no other questions. The only last thing that Lindsay and I wanted to remind you guys all is our next webinar is on October the 19th. Again, same time, 2 to 3. Make sure that you sign up through BC Lung. They'll send out an email for signing up. And our next topic is going to be being lung healthy, cold and flu season. So it'll be a good topic to kind of dive into as we're going into the cold and flu season and how to protect your lungs.
Because you don't want to get sick and then have an exacerbation. Okay. Thank you everyone for attending. We appreciate it. We'll see you next month. Okay.
Thank you
Thank
so
you very
much,
much.
Tracy.
Thank
Very
Thanks,
you.
good.
everyone.
Bye
Very
everyone.
good,
Bye-bye.
very good.